Welcome to The Explainer. Today, we're going to be medical detectives. Our mission? To diagnose a pretty rare skin tumor. And we're going to do it by finding these hidden patterns that the cells themselves leave behind. So we're diving deep into something called Dermatofibrosarcoma protuberans, or dfsp for short. And what you're looking at right now, this is exactly what a pathologist would see under the microscope. It's this dense, swirling mass of pink and purple cells. It might look kind of chaotic at first, but buried right in there are the clues we need to crack the case.
Yeah, I know, it sounds a little weird, right? But believe it or not, the answer to that question is a huge visual clue, one that helps pathologists pinpoint this exact disease. Just stick with me and it'll all make sense in a minute.
Okay, so before we jump back to that microscope view, let's just get the basics down. What is dfsp anyway?
All right, that definition, wow, that is a mouthful, isn't it? Let's break it down into plain English. Mesenchymal neoplasm. That just means it's a tumor that comes from our connective tissue cells. You know, the stuff that basically holds our bodies together. And locally aggressive means it grows slowly, but, and this is the tricky part, it likes to send these little roots deep down into the skin.
So the really key thing to understand is its behavior. It almost never spreads to other parts of the body, but where it is, it's super aggressive. And what's driving all this is a specific genetic mistake. A mix-up where two genes, COL1A1 and PDGFB, literally get stuck together. You can think of this gene fusion as a stuck gas pedal for cell growth. And it's also worth knowing, this thing can sometimes morph into an even more dangerous type of cancer. Okay, let's get back to the microscope and see what all of this looks like on a slide. This is where the fun part, the real detective work, begins. And we're back. So what you're seeing is a standard H&E stain. Just look at that sea of purple. Every one of those little purple dots is the nucleus of a tumor cell. These long, skinny cells we call spindle cells. And notice they're not on the skin surface. They are packed deep inside, in the dermis and even the fat layer right below it, forming this solid sheet of cells. You know what's really striking when you look at this is how uniform everything is. See how all the cells basically look the same? A pathologist has a word for this, monomorphic. It just means their nuclei are all pretty much the same size and shape. And that lack of variety is a huge clue. It creates this kind of monotonous, almost hypnotic field of cells. Okay, and now the big reveal. This is that classic telltale pattern that's finally going to answer our question about cartwheels. Lean in and look really closely at the slide. Do you see it? The cells? They aren't just a random mess. They're actually organized into these really cool swirling patterns, kind of like little whirlpools in a stream, all spinning out from these central points you can't even see. And that right there, that is the classic story form pattern we've been talking about. That is our cartwheel. This pinwheel, this woven mat look, it is the single most important visual clue a pathologist is searching for. The second you see this pattern, dfsp shoots right to the top of your list of possibilities. So the cartwheel tells us what we're looking at, but how it grows is just as critical because that explains why it can be so darn hard for surgeons to get it all out. So to really get a handle on its behavior, we've got to look at the edges of the tumor. You know, how does it deal with the normal, healthy fat cells that are all around it? And this is such a crucial detail. The tumor isn't just a solid ball that shoves the fat out of the way. No, its cells are way sneakier than that. They actually weave their way in between all the little fat lobules. Think of it like pushing your fingers through sand. And this creates another classic look, the honeycomb pattern. That's another huge signpost for dfsp. All right, so we've got the cartwheel and we've got the honeycomb. Those are some really strong visual clues. But in pathology, you always want to be 100% sure. So how do we lock this diagnosis in for good? Well, to confirm what we're thinking, we use a technique called immunohistochemistry. The easiest way to think about it is like using special chemical highlighters. We use these very specific stains that will only light up if the cells have certain proteins inside them. It's a great way to confirm their identity. Now, for dfsp, the big positive stain is called CD34. The tumor cells just light up bright brown for this one. But what's just as important is what they don't light up for, the negative stains. These cells won't stain for things like S100 or desmin, and that helps us rule out other skin tumors that can look a lot like this one. It's really that specific combination of positives and negatives that gets us to the right answer. And then, for the final, no doubt about it confirmation, We can actually look at the tumor's DNA. If we find that specific COL1A1 PDGFB gene fusion we talked about at the beginning, well, that's the absolute gold standard. It clears up any lingering doubt and locks in the diagnosis. So there you have it. We've seen how the cartwheel and the honeycomb patterns are just essential clues for diagnosing DFSP. But this brings up the ultimate question for any pathologist, right? What else can look like this? Because knowing what the mimics are and knowing how to tell them apart using all these tools, the stains, the genetics, that's really the art of diagnosis. It's a constant puzzle, and you're solving it one slide at a time.